Welcome to the very first episode of Beyond the Chart, the podcast that takes you beyond the paperwork and into the heart of healthcare. I'm your host, Candace, and this is Teresa, and we are so excited to be here today.
In this podcast, we'll explore the people, the process, and the compassion behind the care. You'll hear conversations with providers, care coordinators, specialists, and community partners. We'll break down medical topics in a clear, empowering way and share real experiences that show what healthcare really looks like beyond the chart.
Whether you're a patient, a caregiver, a healthcare professional, or just curious, this podcast is for you. So thank you for joining us on day one, and let's go beyond the chart and get started.
So, Candace, what is Heritage?
That's a great question. So we are an HMO-based medical group that has been serving the high desert since 2003. Shortly after, we became an affiliate of Heritage Provider Network, which you also may know as HPN. The affiliation is great because it gives our members access to a much larger network in Southern California. So we have over 200 specialists from the top of the hill all the way down to the bottom. We also play a huge role in coordinating a patient's care. Can you explain that more, because you're a pro at that?
Sure. Coordination of care. Of course, coordination of care is we help coordinate the care between the member and the insurance. So the benefits that the insurance provides to the member is how we coordinate and manage that member's care. We help them navigate between any specialists that they need to see, of course, any appointments that they need, we help manage that. So, of course, we try to take that stress off of the members. We want to make sure that they don't have to worry about any paperwork. So, especially like, for example, the big one is we coordinate their care when they get discharged from the hospital. So if we have a member that goes into the hospital and they need to see a primary care or a specialist, we make sure that we coordinate that care and manage that care depending on the specialists that we are contracted with and that are in network.
So I know a lot of patients think that Heritage is their insurance, but we're actually the one that uses their insurance benefits, and we help manage their care with them. Because a lot of people don't understand that. So
don't understand that there is a difference, or we actually the medical group and not the insurance.
Not the insurance. I think one of the biggest things that sets us apart here in the high desert is that we are affiliated with all three hospitals, right?
And Big Bear.
And
Barstow.
And Barstow. Yep. I think it's a huge advantage because people have the flexibility. They can decide where they want to go, especially living, I mean, the high desert's small, but we're also on opposite ends sometimes. So being able to go to Desert Valley or St. Mary's, depending on where you live, is a really great option. And it also can help with, like if a hospital is full, right? If their emergency room is full, and
definitely
we could, have them go somewhere else. So that's really flexible.
Yeah, I'd hate to have to wait for a bed.
Right. If an emergency is going on.
Yeah.
Yeah. So I think that's, a really big benefit of Heritage.
So what do you think about our urgent care, Candace?
Our urgent care is amazing. They're like their own little mini hospital. I think that they are probably the biggest advantage, I would say. Like, I know there's so many great things about Heritage, but our urgent care is the biggest plus, I would say. They're open 7 days a week. They're closed like maybe 2 holidays. Every other holiday they're open. And we don't just have RNs, right, or medical assistants. We have RNs, PAs, physicians. We have labs on site. So if we need to draw your labs, we don't have to wait for, Quest or LabCorp. We don't have to send you to a lab. We can do it right there. We could pull it and see what's going on. We also handle cardiac issues. A lot of urgent cares do not do that. We are just capable of so many things. There's so many big other words that they're able to do with procedures, and I don't even know them all. But I mean, it's crazy what that urgent care can do. We also have CTs on scan. Or on site. We could do ultrasounds, X-rays. If you have a broken foot, we're gonna let you know if it's broken.
And even if we can't do it, we can't do the imaging on site. They'll work on getting us a stat referral to one of our imaging centers. Personal experience, they got to get a personal stat referral for me, and then I got to go and get my stat MRI, so that I didn't have to wait 2-3 days or weeks even to get any imaging done.
So you don't have to even go to your primary care. Our urgent care just took care of that referral.
That leads us to the fast track referrals.
Yes. Oh, okay. Look at that. Yeah. So our fast track referrals, right? We get those approved in like 24 hours. It's great. So yes, we get them approved, and then at that point, you would call the specialist, right, that it was approved for, and then get that appointment made. Our doctors, once they send that information in, our referral department goes through it. It's ready to go for you, and you're notified either by phone or also you receive it in the mail.
Yeah.
So that's huge too, especially for someone who's going through maybe a chronic illness or they need referral for a broken leg or a broken ankle. We're gonna go ahead and get that done so you can get that fixed.
I'd hate to wait 7 days for a referral.
Yeah, with my arm
My arm broken
in a sling.
Yeah.
No. So that's a huge one.
Yeah. Even it's even fast. It doesn't necessarily have to be through the urgent care. I mean, once we receive the notes from the provider that's sending you to specialist, I mean, it's fairly quick. I believe that it's usually, in personal experience, it's been, my time working there, it's usually taken up to 3 days. But I've never seen a referral go past 5 days.
Yeah, no,
for an approved authorization.
Yeah, I haven't had that experience.
So that's
either.
great. That's pretty.
Yeah,
it's pretty awesome.
Yes, yeah. I think that's a huge one too. A lot of our members are really thankful and excited for that 24-hour process.
Yeah, fast track referrals.
Yeah. I think another important factor in Heritage is our member services.
Oh,
you worked in member services for quite some time.
I did.
What did you do there? How is that beneficial to me as a member of Heritage?
Being an HMO, we help manage that care. So not only is it all the other, the specialists, and, all those, the referral coordinators, it's more than that. I feel like having member services on site, I know there's some people that don't have that member services on site where they just can't walk in and be like, hey, can I get help? You have to call this 800 number and you have to wait for someone to, to help. We're on site, we're local, so very familiar with the area. But some things that they could help with are, one, selecting a primary care doctor. So sometimes, you need to find the health plan assigns you a primary care doctor, but for whatever reason, you don't feel comfortable with this primary care doctor, or they need another, some people prefer males over females, or females over males. Member Services is able to help connect with the health plan and make that change. Billing.
So the member's not doing it on their own.
Not doing it on their own.
Which is amazing.
It's that coordination.
Yeah.
It's being able to walk you through the process. They do billing questions. Sometimes some providers will use a different lab that unfortunately we're not contracted with. So, the members freak out, and it's good. It's fortunate for them to be able to walk in and say, here's my bill, I need some help. Referrals, same thing. They're able, if for whatever reason you didn't receive your authorization in the mail, they're always able to help with that and getting you those appointments as well.
Yeah, so that's true. I have heard them even call with the member
there
and get them an appointment. Sometimes even get a sooner appointment. Yeah, which is really
And then
helpful.
even if member services can't help, because like, for example, pharmacy questions, the medical group is not, we're not the ones that determine that benefit. So if that's when it's a health plan question, they're able to give the health plan a call with the member there. And especially, I think it's good too, because your members, we can expect them to know
and
the medical
lot of our
terminology.
Are seniors, right?
Yeah, a lot of our members.
Medical terminology.
Medical terminology is a big one. It's that miscommunication between the provider's office.
Yeah, my mom, she's a senior, and she has a hard time over the phone. And so I think having that member service person who knows what they're talking about, who does know the medical terminology, is so helpful for our members. So agreed.
It's a part of coordination of care.
Yeah. Which is what we do.
Yep. Coordinate the members' care.
Yes. Okay, so other member benefits. Our wellness department. I love our wellness department.
Yeah, they do everything.
They do there?
They do everything.
They do it all. They do it all. Yeah, so with your Medicare Advantage plan too, they want you to get that annual wellness done, right? So a lot of medical groups, they have wellness centers made specifically for that. So our wellness department, you can get your lab work done. You get your annual wellness. We have Dr. Hogarth there who does diabetic eye exams. He's amazing too. We love him. He's
great preventative care.
Yes, very, very good preventative care. Yeah, they'll go over, they do, I believe, like an EKG. I think they do like a breathing test too. They go over
fall
signs.
Risk.
Yes, fall risk, signs of dementia. So it's just really a really good preventative exam for you. And it just kind of gets the ball rolling. Even if you need some like cancer screenings, like your mammogram or colorectal, that's kind of where that begins. So, we love our wellness department. We have Kathleen in there too, who does do the fall risk.
Yeah. Educational classes.
She does our educational classes, and she's always there to talk to. She's amazing. So, we also do weight management. or even like dietary management. So depending on, say you have celiac disease, right? Or you can't have anything gluten. We have a dietitian who can go over all of those like symptoms of it, and then also how to like maintain it, how to eat better so you're not having those symptoms of it.
Naoko.
Yeah, Naoko.
She's great.
Yeah, she's also really amazing. So we have a really big team that kind of embraces all of your medical needs, and we're here to help. You just
Most of all preventative.
Mostly all preventative. Of
Preventative
course,
is very it's very important.
yeah.
Dr. Hogarth
Yep.
checks the eyes, and if he sees some type of cataract, then he's gonna make sure to catch it before
It turns into more.
we want it to get worse.
We have the resort.
Cover the resort, yeah.
We love the resort. We are normally in the resort.
Yeah, normal.
Yeah, normally. Except for when we get to do fun stuff like this. But the resort, what is the resort?
I like to say that it's a great place to stay busy.
Yeah.
Not only physically, because we do have chair exercise.
Yeah.
But it's a great way to keep the brain busy, being Alzheimer's and Brain Health Awareness Month.
Yes. Yes.
I'm actually very big on keeping the brain healthy.
Yeah.
Family with Alzheimer's and dementia in the past, of course, it's very important to keep the brain healthy. It is for our seniors, 55 and over, or Medicare, early Medicares. We like to have those too. We welcome them too. We have a lot of benefits. We have a lot of classes, educational classes, exercise classes. We do Tai Chi, soul line dancing, but it's all not just physical. We also have doctor talks and Nurse Kathleen educational talks. We have social clubs, so Tuesdays and Fridays we have our little coffee club, and they get to hang out. Again, I think that's very important for the senior brain.
It's like a community, right?
It's like a community.
A lot of our members may have lost their spouses, or they just need that socialization, and we're there to offer that. They hang out with each other outside of the resort, which I think is so cute.
They make friends.
They make a lot of friends.
And they share other resources, which is great.
They do. They share a lot of resources with each other. I feel like they help each other in a way too, and they help us. I mean, they bring us gifts and they educate us. Yeah, I think that you and I are going to be ready when we turn that age.
Yeah.
We're going to know when to enroll in Medicare. We're gonna
especially
know,
that, girl. That's too much. Too much for me.
We're going to know where the food banks are, where the senior days are, because we just we've created relationships with some of our members, and we love them just as they're like our grandpas and grandmas and uncles and aunts.
Uncles and aunts, definitely.
So it's been really, really rewarding for myself to work in the resort.
Yeah.
We have our bus trip coming up.
Oh, exciting.
We're going to go to Big Bear. So we're going in July, but signups are this month, and they take signups very seriously.
Yeah.
So we know we're going to have a line.
I mean, we've got to think about it. This is our time to get out.
It is our time to get out.
This is what they want to do,
Yes.
so.
Yes. And
they are very serious.
Heritage covers it. Actually, Scan is going to help us sponsor this one.
Thank you, Scan.
Yeah. Yes, thank you. But we're going to Big Bear, and then we're going to go to the zoo, and then we'll probably walk around the village for a little bit, and then we're going to give them lunch. It'll be a nice day. Last year we went to the Huntington,
the gardens.
The gardens. It was it was beautiful, and they had a blast. It's beautiful, So it's something that they look forward to.
It is very physical.
It is very physical,
but it's very good for their brain. They get to get out.
Wear your walking shoes.
Yeah, wear your walking shoes.
We also do a senior prom every year.
That's exciting.
That's my favorite.
Yeah, that's exciting.
We get to get dressed up. They get to get dressed up. Oh my gosh.
Some of them never even went to prom.
Some of them never went to prom.
So
I know.
they love it.
So we give them that experience, and it's 5 hours of dancing, and they dance.
Dinner,
pictures,
raffles.
It's a good time. So the resort is huge. It's to keep that mind going, that body going, and just to provide a sense of community. Especially if you don't have somebody at home. So we're there. So come hang out with us. Okay, so for someone listening to this, right, what do you think the three main takeaways are? What is Heritage, what we have to offer them, and why they should come to Heritage?
I want to say coordination of care.
Big one.
Coordination of care is very important. The fact that we have access to all three hospitals, including Big Bear and Barstow. Is very, and of course we have contracts with down the hill. So I know a lot of people.
We didn't even mention that.
A lot of people are always worried about do I really want to get open heart surgery at Victor Valley Hospital?
True.
Do I really want to get open hearts? That's just a personal, they're just like, do I really have to go here I don't want to go there.
Yeah.
So because we have such a large network of specialists, we're able to refer them not all the time where they would like, but we're able to give them more options because we have a larger network.
So, like, I think Below Melinda is one of them. That's a big one. A lot of people, Arrowhead, UCI.
For ortho.
And what's our children's hospital? Because Chalk, is it Chalk?
We use Chalk, Loma Linda.
And then
Cedar Sinai.
Yeah. So it's huge. It's really great.
So that's one thing.
Yeah.
I think having a large network, a medical group that has a large network, we have more options to be able to send someone. So when you manage someone's care, you don't want to be, as a member, you don't want to be limited to only two hospitals, only one cardiologist. Like, we have a large network of specialists. I think that's one.
I agree.
So 2 is our urgent care.
Yes, hands down.
I am a diehard Heritage Urgent Care fan.
Me too. Me too.
I love everything that they do for us. The stat referrals is very important to me. They always, even when you get out of the hospital, they're like, well, follow up with your primary. But when you go to the urgent care, they're able to get you that referral process. And
that part's taken out automatically.
Of course, we don't have control over the specialist appointments, unfortunately.
Right.
But member services is always there to advocate for the member. Of course, if they need, if they need any help or getting a sooner appointment, that's 2. And 3, I would say for our seniors, the resort.
Yeah. I agree with you. It's so unique
It's
up
kind
here.
of hand in hand, the resort and the wellness center. I mean, but when they think wellness, a lot of people are like, wellness, they don't really care.
They want the fun stuff.
They want the fun stuff.
Yeah.
So I want to say the resort and the wellness are kind of hand in hand.
Yeah, agreed.
And we have our quality programs too.
We do have our, there's just too much.
Yeah, there's just too much. It's too good, girl. Too good.
Well, we hope you enjoyed today's podcast and you're able to take away some information for more education and more tips and all things medical. Please follow us on our Facebook, our Instagram. We're on LinkedIn. We're on TikTok now. Facebook and Instagram is hvvmg.com. Not .com, that's our website. Don't forget about the website too, because we actually just updated that. And so we're constantly putting content on there and education for all your medical needs. So we invite you to go and follow there and then be on the lookout because we're going to continue doing these podcasts and we're really excited. So until next time, thanks again for joining us on our very first episode and the first day. And we look forward to seeing you next time on Beyond the Chart.